When we said, what if we disrupted the status quo, we meant it. We are a $100 million campaign to transform healthcare, right here at home. Our communities joining together, a powerful force, fearless in the pursuit to advance care. For the patients and families who count on us, momentum is building. Donors have already answered the call and are influencing change through the QE2. Their generosity touching nearly every care area, every patient cared for. We have so much to be proud of and so many thanks to give from this past year. And it all starts with COVID recovery. The pandemic caused delays for patients needing diagnostic scans like CT, ultrasound, and MRI. While urgent appointments were not canceled, the wait times for scheduled scans did increase. From the donor-funded QE2 COVID-19 Response Fund, $1.2 million is helping tackle wait times, extending the hours of operation and increasing staff resources.
So COVID had a huge impact on what was going on in diagnostic imaging. Over the course of the first sort of 3 to 4 months of the pandemic, we deferred about 25,000 outpatient examinations because the province wanted to shut down the elective care so we could make sure we maintained capacity in the system. Really urgent studies we kept doing. Anything related to cancer care we kept doing, but about 50% of our volume we had to defer. There's a huge impact across the entire health system when you can't get your imaging study. If it's delayed by a couple of months, that means that your cancer diagnosis gets delayed by a couple of months.
In this period of time, we would often have patients who were living in pain, living in discomfort, distress, not knowing what's wrong with them.
At the end of the day, you need people to run the scanners, take the pictures, read the studies, and make those diagnoses. And so we were looking for support to hire additional technologists, to run our scanners longer hours, to be able to do more patients.
So to alleviate some of the backlog, the QE2 Foundation provided funding to create jobs and hire more people, to extend our hours not only into the nights, but also into weekend hours.
In aggregate, across all 3 modalities, we're doing roughly an extra 300 to 350 patients a week from the backlog. Thank you. Without the generous support of the foundation, people would have been experiencing delays in care for years to come.
COVID recovery is something that unites us all, here and around the globe. The same can be said for cancer. Chances are that you yourself or a loved one has experienced cancer. Our 2021 BMO Ride for Cancer, an unstoppable force, saw more than 1,200 riders on the road and trail unite for an incredible impact, $1.9 million net raised. These funds are critical in unlocking more personalized cancer treatment options than ever before. Logan McLean was the 2021 top youth fundraiser in BMO Ride for Cancer. Even at the young age of 12, Logan already knows how devastating cancer can be for families. He rides to change the future of cancer care.
My name's Logan McLean, and I'm in grade 6. I like to sail, I like to play hockey, and I like to go biking. In 2021, I did my second Ride for Cancer. I rode 50K. I was the top youth fundraiser. I raised just over $2,000. It was just really fun, a good experience. In 2021, my 7-year-old family friend passed away from cancer. I sort of just want cancer to go away forever.
There are thousands of different cancers out there. Not everyone's cancer is the same. In the last several years, we've begun to realize from the genomics, or looking at the genes, that tumors express genes differently, and in fact, we should probably be potentially treating them differently. And with this technology, we can start to narrow it down, tailoring treatments to patients and target treatments that will work better for patients. You can see there's a passion from the QE2 and the QE2 Foundation to improve the care for cancer patients in the province.
From raising money, donating, just helping out with the events, I think everybody can make a difference.
Giving back is something ingrained in us here in Atlantic Canada. We are known for our compassion and how we care for each other. And nothing hits a community harder than a family tragedy.
Canada was supposed to be a new beginning for the Barhos. They fled the horror of Syria, but it found them here this morning when fire consumed their house and took the lives of all 7 children.
Ahmed was the oldest, 14. The youngest, Abdullah, was just 3 months old. Both parents survived. The father, though, is clinging to life tonight.
The husband was in a coma with an unknown situation, whether he would survive or not. And Kauthar, the wife, was the only survivor of the fire unharmed. And of course, it was a shock to myself and the rest of our community. And right away, we knew we had to do something about it and plan for fundraising for the family. In the beginning days, and actually days, it's more like beginning months of the tragedy, we spent a lot of time in one of the family rooms at the hospital between our board members and volunteers, thousands of hours in that little tiny room over the course of months, helping Kauthar.
The feeling that the hospital and everybody who volunteered there have done a lot to make Kauthar and her family members who came from everywhere just to feel that they have everything they need.
They brought in interpreters, translators, and recognizing the amount of effort they put in. Lubna and Lama, they wanted to acknowledge that.
We booked a meeting with the QE2 Foundation representatives, and so then they suggested that we would raise funds to renovate the family room. So we loved the idea, and so that's when we started doing the actual fundraising events.
We did a lemonade sale at the Commons. It was so much fun.
We did paint night, we did henna event, and that attracted a lot of people from the overall community.
They targeted businesses or the general public. They worked with federal MPs or local city councillors, and that's how they raised most of their money. So the particular room that was renovated looked identical to what we've seen before, and it was a traditional family room that you'd see in the hospital.
Things that are added to the room is a pull-out bed, which makes anybody who's gonna stay at the room feel really comfy. And then they added a kitchenette, which is a new addition, and it's a good addition.
It's very inviting, warm colors, very bright.
It was like an office space before, and then now it's more homey and more comfortable.
People who are typically using those rooms have gone through a form of calamity or difficulty or tragedy, and any way to actually help them ease their hearts and minds, both physically and spiritually, is something that is an honor to us to be part of, and I hope that sense of calmness and peace is felt by everyone who visits the room.
We are extremely grateful to have many community fundraisers, like the one organized by Barho Friends, take place throughout the year. Collectively, more than $430,000 was raised by those wanting to give back. Thank you to our QE2 champions for making a big difference. Heart health patients will also experience the powerful impact of donors coming together. More than $4 million was raised to fund best-in-class technology within the QE2's new Stuart E. Allen Hybrid OR. Atlantic Canada's first hybrid OR is named in honor of Stuart E. Allen, who made a $1 million donation towards this initiative. It's a life-changing space for patients needing critical care. These are just a few of the stories where donors are having a tremendous impact through the QE2. From research in the lab to new technology and spaces, bedside care, and education for staff and physicians to stay up to date, thank you. We are transforming healthcare together. If all this can be achieved while learning to live within a pandemic environment, just think what is possible in the years to come. Just wait and see.